Hi, my name is Emily. I'm a nursing student here at Harper Hospital. I was just sent in from the provider. I know he just kind of went over a little bit of information regarding a new diagnosis, as well as some medications that he prescribed. So I'm just going to go through this information in a little bit more depth, just to make sure you don't have any questions and everything kind of makes sense. So to start, your diagnosis was the chronic heart failure. So essentially what that's meaning is there's a decrease in the heart's ability to pump blood effectively. And this causes a number of things. Because of the heart isn't able to pump blood effectively, it causes a decrease in blood flow to the kidneys, which then leads to decreased urine output. So because of the decreased urine output, as well as the heart's inability to pump effectively, this can cause things such as increased heart rate, increased blood pressure, as well as fluid retention. So fluid retention, what that means is essentially excess fluids. So because you're not urinating as much or as frequently, the fluid remains in your body. So it can cause things such as edema, which essentially means the excess fluid may go to areas such as your legs, ankles, or feet that can cause swelling and things like that. So kind of staying on topic of the fluid retention, one of the things that we recommend for patients with chronic heart failure is to take daily weights. The reason why we want you to take daily weights is to make sure that you're not having too much fluid retention. So for the daily weights, we recommend you take them in the morning and typically around the same time, just so, other factors don't change the weight. And a key thing with the daily weights is you want to make sure that you report to the provider weight gain of 2+ pounds. So let's say hypothetically you took your weight yesterday and it was 142 and you took it the next day around the same time at 144. You would just want to let the provider know. And then from there they can decide kind of what they want to do. And then another thing that we talk about with fluids for patients with chronic heart failure is limiting fluids. So because you're already having this excess of fluids, we want to make sure that we're not just putting more and more fluids in your body that, we're not getting out in a timely manner. So I'll review with the provider the exact fluid restriction that they want. But fluids, what they're talking about is essentially anything like water, beverages, sodas, broth. So those are kind of what we're keeping track of. One thing we want to do for the fluid restriction is making sure that we spread out our fluids throughout the day to avoid things like thirst and dehydration. One thing that often helps patients is to suck on hard candy, as this helps decrease the feeling of thirst. And then another thing that we want to kind of talk about is just a little bit of a diet modification. So because the kidneys, when you urinate, they help you get rid of sodium. So because your urine output is decreased from the chronic heart failure, we want to have you on a low sodium diet to make sure that you don't have too much sodium in your body. So things we want to kind of avoid, if not limit, is things like fries, chips. Oftentimes things in the frozen foods have often a lot more sodium, or canned foods. So just things we want to be familiar with and kind of being able to read our labels. And then before I go on to review your medications, I just wanted to make sure you didn't have any questions about what I already went over. And then specifically regarding the diet modifications, if you had any questions or any concerns about having access to get the foods that you need. Okay, so since you have no questions at this moment, I'll kind of go forward with the medications. So the first one that I wanted to start with is the Lasix. So Lasix is a diuretic. So essentially what that means, oftentimes you'll hear it called a water pill, but it causes you to increase your urine output. So it helps to get rid of excess sodium as well as water. And then you want to take this medication in the morning because it does cause you to have to use the bathroom fairly frequently to urinate. So we want to make sure it's not disrupting your sleep. So that's why we recommend taking it in the morning versus the nighttime. And then another thing that I kind of wanted to go over with you, as well as getting rid of the excess sodium in water, it also gets rid of potassium. So because of that, there is a risk for hypokalemia, which essentially means low potassium levels. So to avoid that, what we want you to do is to eat foods high in potassium. So these are things like bananas, dark leafy greens, potatoes, cantaloupe, tomatoes. And again, this is to balance out that loss of potassium. And then there's other things, the side effects that this medication can cause, such as hypotension, essentially meaning low blood pressure. So kind of like how we talked about before, because of the decreased urine output, that's causing your blood pressure to increase. But if you are losing too much through urinating too frequently, it can cause hypotension or the low blood pressure. So you want to make sure that you are monitoring both your heart rate and your blood pressure before getting this medication. And also we do labs regularly with you to monitor for things like the hypokalemia, the low potassium level, as well as there's a possibility for hyponatremia, which is the low sodium levels. So again, these are things that we can monitor through labs. We just want to make sure that you come in and everything like that. Another side effect that I just wanted to kind of go over with you for the Lasix is ototoxicity. So this can affect the hearing in the ears. So if you notice any ringing or anything, please call the provider right away. All right, before I go on to your second medication, did you have any questions regarding the Lasix? Okay. Since you didn't have any questions regarding the Lasix, I just went over with you, I'm going to move on to your next medication, which is digoxin. So moving on to your next medication, we have digoxin. So we talked about how the chronic heart failure is decreased your heart's ability to pump blood effectively. So digoxin is used to increase the efficiency of the heart's contractions. And in turn, because it's helping that your heart beat more effectively, it can also reduce your heart rate, this medication. So before you take this medication, you want to make sure that you are checking your pulse. So you check the pulse before you take the medication, and the provider provided parameters for the medication. So if your pulse is less than 60, you're going to want to not take the medication for that time, because we want to make sure that your heart rate is not getting too low. As well as before you take this medication, you want to monitor your blood pressure. So with digoxin, like the other medication, we are going to want to do regular labs. One of the side effects or risks with digoxin is digoxin toxicity. So we monitor this through your lab values to make sure that they're within normal range. But in case you're at home and something like this were to happen, just some signs and symptoms I want you to look out for. These would include gastrointestinal upset, fatigue, weakness, vision changes. And one other thing to note, hypokalemia, which we talked about earlier, which is the low potassium levels, that increases your risk for digoxin toxicity. So again, just want to reiterate that it's really, really important that you make sure that you schedule your lab work and make sure that you come in at your scheduled time. And again, just to look out for those signs and symptoms that we talked about. And if you're experiencing any of those, to reach out to the provider. And just one more thing to go over, this kind of touches on for both medications because it can decrease your blood pressure as well as your heart rate. We want to just make sure that when you're moving or changing positions that you do it slowly. So we want to make sure, because if you have any dizziness or your blood pressure is too low, we don't want you to stand up too quickly or change positions and get dizzy. All right, well, since you have no other questions, you can go check out at the front desk. Make sure you schedule your labs. Have a great day.